We're back with another edition of the Federalist Radio Hour. I'm Emily Jashinsky, Culture Editor here at The Federalist. As always, you can email the show at radio@thefederalist.com. Follow us on Twitter at FDRLST. Make sure to subscribe to our YouTube channel as well. Today, I am joined by Gary Humble. Gary, thank you so much for taking the time to chat with us today.
Yeah, it's great to be with you today. Thank you.
Absolutely. Now, Gary, tell us a little bit about what you do and particularly what you do as it relates to what your governor, Bill Lee, has been doing recently.
Yeah, so run an organization called Tennessee Stands, and we're really responding to government overreach here in Tennessee, like probably so many of us are facing across the country in response to COVID-19. And one of the first ways that we did that was filed a lawsuit against Governor Bill Lee, specifically over his use of authority under our emergency powers statute, which essentially gives him the ability to make law in our state and delegate power to whomever he feels like should have power. So we don't think government works that way. So that's sort of how we started. We've got legislation in place now regarding religious exemptions for vaccines, with the pending mandates coming and all sorts of things going on.
I want to ask what the response has been to that effort from the people of Tennessee and also from lawmakers in Tennessee. I'm curious as to whether there's been a bipartisan response or if it's really mostly just been Republicans, maybe even Republicans you're having a hard time with them. How have people responded to this effort that you've embarked upon at Tennessee Stands?
Yeah, it's a mixed bag. The people in general, I think, tend to follow what you sort of see on mainstream media. You've got an ideological divide. And so you've got half of citizens of the state that are kind of rah, rah, rah. Yeah, we're tired of this. We want limited government. You've got the other half saying you guys are horrible, selfish, just wear your mask. You must want people to die. And so, you deal with that. On the legislature side, as far as elected officials go, elected officials are hard because most, especially if they're a Republican, publicly want to support their conservative Republican governor. Not many sitting elected officials want to repudiate Governor Bill Lee. However, I will tell you there are several conservative legislators that have a huge problem with what's going on. And there's actually quite a battle going on right now between our Senate and our House over what they're going to do this coming legislative session in dealing and how restrictive they really want to be starting January 12th when session comes in. The House seems to have a few more plans on how to rein in the governor's power. The Senate seems like, we're kind of good with the way things are. So there's all of those politics going on as well.
And what's the substance of your legal opposition to what's been going in Tennessee? If you could just sort of walk us through a little bit of your objection here.
So our emergency power statute in Title 58 to 107 is where the governor draws his authority under an emergency, where our emergency power statute is interesting. I think it's one of the most generous actually in the country because the governor can unilaterally call an emergency. He can renew the emergency every 60 days with no action from any other government body. And those renewals are unlimited. So once the governor has executed an emergency, he's made himself a king. He has the sole authority every 60 days to renew that emergency, and with no limits. Some other issues is that the statute gives him the ability to make executive orders with, quote unquote, the force and effect of law. There's nothing else that I know of that has the force and effect of law than laws. So the government, the governor makes laws now in our state. And then lastly, it gives him the ability to delegate powers as he deems prudent. So here's some quick things. Just similar to Michigan, the Michigan case where the Supreme Court ruled that it was unconstitutional for a legislative body to delegate its lawmaking authority to an executive body. That was based on a very strict, I think it was Article 3, Section 1 of their Constitution, a very strict separation of powers doctrine, where it states that here we've defined these powers with the legislative branch, executive branch, and no members of any of the other branches of government can execute on any of the other powers. We have a similar statute, almost verbatim, in Article 2, Section 2 of our Constitution. And so based on that, we're simply saying, according to our Constitution's strict separation of powers doctrine, a member of the executive branch cannot operate with functions of the legislative branch. It's just that simple. So we've made that similar claim here. And then on the delegation of powers, our governor has gone on national news really touting the fact that he's left decisions to local leaders. That's been the big claim. I'm a big conservative because I've not made a statewide mask mandate. I've just let the counties do it. Well, the problem with that, one, he's enabled total tyranny in some of these. In Nashville, in Memphis, and Chattanooga, very, very liberal local governments. And so they're under, the type of leadership that you typically wouldn't see in our state from a state level. But in terms of the delegation of these powers that he's so proud of, he's given by executive order county mayors the authority to issue mask mandates. He's assigned them a new duty. Article 7, Section 1 says, black and white in English, that duties of county executives are prescribed by the General Assembly. There's no COVID exception. There's no emergency exception. If you want to give duties to a county executive, that must go through the General Assembly. Our governor, under this emergency, has taken upon himself as the executive to issue these new powers himself. It's unconstitutional. So those two factors are the crux of our legal argument against the governor.
One of the most interesting things about your case study here is that I think it speaks to a bifurcation, not of the Republican Party, but more of the Republican electorate. And one thing that I've noticed is some people, and I truly mean that I believe that this is reasonable. Nobody knows what to believe in terms of science anymore because the entire industry has just been so corrupted by politics. But I've sensed, at least, that you have half the people who are sort of eager for more government intervention in their personal lives because they're terrified. Then you have the other half who realizes, and I don't know if it's exactly 50-50, but you have these two groups. The other group believes firmly that their lives have been encroached upon, or their personal liberty has been encroached upon by the government, and they may not have ever seen that before. They may have been sort of newly awoken to the perils of government encroachment on personal freedom. What have you sensed as it pertains to sort of like Republicans? Because I do actually think this split affects Republicans as well.
So I have definitely experienced that split here. So here's a great example of some differentiations and even you would say conservatives. On this particular bill, for example, that I'm running regarding a religious exemption to vaccines, currently in the state of Tennessee, as in many states, I think there's about 10 states running similar bills, we have religious exemptions to vaccinations, but in the case, by our law, in the case of an epidemic or the threat of an epidemic, those religious exemptions go away. No more exemption. So we're running a bill to secure those exemptions and strike that exception language. When talking about this bill to conservatives, some of our most conservative members of the legislature, they're like, well, Gary, I understand, we should secure a religious exemption, but I'm not so sure that someone else has the right to make me sick. That whole logical argument. Well, it's like, well, also maybe we just shouldn't let everybody else get on the road because God forbid they may wreck into you and kill you in your car. I mean, it's that whole logic. But I think there's literally still a breakdown, even in conservatives, where we have this mindset that government has a role or a duty to keep you safe. And I would argue that government's first duty and role is to secure liberty, not to keep me safe. In fact, our governor, if you look in our Constitution, his oath is constitutionally defined. He takes an oath to do two things: to uphold the Constitution of the state of Tennessee and to uphold the United States Constitution to the best of his ability. And that oath ends with, so help me God. He had, so government officials, at least in Tennessee, have a sworn oath to defend and protect liberty and uphold our constitutions, not to keep us safe. That's a very statist mentality whenever we just feel like, well, government must have some kind of role to provide for the safety of the citizenry. In my view, and when I look back at our founders, that's not why they instituted government. We had rights that existed prior to government. We wrote a constitution. We formed a government with one purpose: to secure those rights that already existed. That means that government can't take them away. We've lost that in 2020, but there's still a very large divide in that mentality, even in the Republican Party, as to what is the true and appropriate function of government.
What's the most persuasive case that you make for your efforts to a skeptical person? How's the best way that you would make this argument and saying, look, this is important for this reason? And I ask that question because there are, among Republicans, as you just spoke to, and among independents and among Democrats, there's so many people just wondering what the right answer is to this incredibly complicated and high stakes problem. So what's your best argument for why you're pursuing this case?
For me, we have to secure our Republican Federalist form of government. If we don't hold, so right now you just throw the Constitution away. We're not following it, period. We're not doing what it says. Legislatures are doing what they're not supposed to do. Executives especially are doing what they're not supposed to do. We're not following if we're not willing to follow the Constitution, and if our Constitution is always up for negotiation, depending upon the circumstance of the day, well, then guess what? We don't have a government of the people anymore. There's no more we the people, because the Constitution is the we the people. Without a Constitution, we simply have a we the government. We have a government that, depending upon the circumstance or what it feels is necessary to do to respond to what's happening, it makes its decisions based on a whim, not based on the rule of law. So what I'm trying to get people to understand is that holding to the constitutional principles that are set in place, demanding that our elected officials don't exceed their constitutional authority, is critical, no matter what you believe about this virus, no matter what you believe about the safety that you need from COVID-19, because without adherence to those strict principles, there is no more we the people. And God forbid that we live in an America where we the people no longer exist. That, to me, is what's at stake if we don't correct our response to what's happening around us.
Why do you think the left is so eager to make some of these power grabs that you've highlighted? Because the left should, of course, have a vested interest in we the people and in maintaining our Republican federalism in the government. Why do you think, though, that there has been this eagerness to make power grabs when it comes to COVID regulations? And do you think that, in general, people are going to have a really hard time going back when the emergency is over? Because a lot of these around the country have been issued on an emergency order basis. When the emergency is over, do you think there are going to be a lot of leaders who sort of cling to these emergency orders?
That's a great question, and yes, I do. To the first part, I wouldn't say that I wouldn't say that the left necessarily has a vested interest in we the people as much as it has an interest in we the left. Yeah. I think the left likes the left. And, my take on that is that they'll do whatever it takes to see their ideology succeed. So I think if that means down with America and down with the constitutional form of government, so be it, as long as we're able to push our agenda. And I think for me, that's really the strict dividing line between those of us on the right and the left. I mean, I'm okay with arguing differing opinions, as long as we can hold to our principles of separation of power, and checks and balances and a constitutional form of government. But they're interested in letting that go. To the other question of, will this all go back to normal? God, I sure hope so, but I don't know. And I will tell you something specific here to Tennessee that's interesting. We have a state statute in Title 68, which governs our health policy, that defines the powers and duties of local county boards of health. So We only have we have county health departments, but we have a separate thing called a board of health where counties have the ability to institute their own board of health. And I think we've got maybe 3 or 4 of those. Actually, so in Knox County, their county commission is voting to dissolve their board of health right now. And the reason is because our state statute, not in emergency powers, gives the board of health the ability to claim an emergency and do things like make policy, issue civil penalty, close businesses for the health and safety of the public. What's been discovered, they've never really operated like that before because I guess they've never felt the freedom to. Well, enter COVID. They have now taken this newfound authority, and what we've discovered is that, wait a minute, when emergency powers or the emergency status goes away, Title 68 still exists. And these boards of health by state statute still have this incredible amount of authority that they can wield that does not require an emergency declaration. And so now you've got counties like Knox County that are saying, well, and if that's the case, we're going to dissolve this board because we don't want this board to have this power after COVID.
You just used a key buzz phrase, not a buzzword, but a buzz phrase, which is the health and safety of the people. And I'm curious, right, exactly. This is what I want to ask you about is how do you approach making an argument against the health and safety? And this is something that the left does on a myriad of issues, if not every issue, but they sort of find the best sort of sympathetic and easy way, facile way to make their case because it's typically emotional and personal. But what is your argument against people who say, listen, this is killing, you're literally murdering people, you're killing people with your position on this issue?
I mean, look, first off, I never try to get into the scientific debate because, I feel like everybody, no matter what's out there, is going to gravitate towards what they already believe anyway. There's science in data, and you can represent the data in several ways to fit your ideology. So I really try to stay away from the science debate. But the fact of the matter is, for me personally, I don't see people dropping dead around me every day. I just don't. In fact, I know quite a few people who have had COVID. I'm fairly certain I've had it, but I know a lot of family and friends who have had it, who've been tested. They're positive, and they're just fine. That's my personal experience and what I see as I've observed this virus. But the point is, yes, we should all be healthy. Yes, I don't want to kill grandma. And yes, we should care about the health and safety of our neighbors, but not at the expense of liberty, not at the expense of tossing the Constitution in the can because we've got to do super or extraordinary things to protect the health. And also to that point, I think health and safety includes mental health and emotional health. And I will tell you, the evidence is clear. The statistics are in. And in Tennessee, reports of child abuse are through the roof. Our education system is suffering. Our economy is suffering. Businesses are closing. Families are hurting. Domestic violence is up. Deaths from opioids are up. So, yes, when you think about health and safety includes more things than just COVID-19. We can't simply continue to test for COVID-19 and say the cases are going up, health and safety. There's other things that impact the public health and safety. And unfortunately, we're not paying attention to those. And it's a shame.
Have you heard from people that have some of those terrible stories of relapsing and suicides of loved ones? Because I imagine that they are very supportive of what you're doing. We've interviewed some of those folks here on this podcast, but I think a lot of people who may be distanced from some of these deaths of despair that have been heightened over the course of the pandemic don't understand how bad it's gotten.
There's no question. Look, I live here in Williamson County, Tennessee. someone consider the fact that I live in the reddest county in the reddest state, right? And even here, someone connected to our organization, she's a nurse here at our local hospital, and I've heard from her firsthand. She had like 4 in one day. It would be typical maybe on another year to see young people come in with depression or attempted suicide issues, maybe, I don't know, 10 a year, something like that in our county. She called me when she saw 4 in a day. 4 in a day. Kids right here, Williamson County, trying to commit suicide. This stuff is real. And we need to pay attention to it. So yes, I've seen it firsthand. And of course, in other metro areas around the county, that issue is even worse. Williamson County, it's not rural, but we're not one of the metro areas. But we have to pay attention to the whole problem. There's more. The president said it himself. The response cannot be worse than the disease. And I truly feel that's what we've done. That's where we are right now.
The lockdowns impact small business owners and particularly restaurant owners, especially hard. And those are not always Republican demographics, restaurant owners in particular. Have you heard from any folks that might be in that boat who might generally be Democrats or liberals who, because of these lockdowns, are looking to people on the right for help because their businesses have been harmed so badly by these lockdowns?
That's a great point, and I think you nailed it. Restaurant owners and bar owners, that particular demographic, they are over it. I mean, politics aside, whatever else it is they align with politically, they sort of don't care at this point because they're losing everything. Just yesterday in Memphis, in Shelby County, the local health department issued a new ordinance because the numbers are going up, right? They just went back and limited all of restaurant capacity to 25%. Now, that's a nice thing to say when as a health department, you're like, well, man, if we can just cut restaurant consumption down to 25%, well, then we can mitigate the spread of this virus and flatten the curve and all that stuff. But if you go to a restaurant owner and ask the restaurant owner, can you survive on 25% of your normal revenue? More likely than not, that answer is going to be no. So it doesn't matter. It's like, well, we're not closing you. Well, no, limiting a business to 25% of its revenue is closing the business. I don't understand why that's such a hard disconnect for these bureaucrats to get through their heads. Maybe they've never run a business. I've run several. 25% of your normal revenue doesn't work. The math doesn't add up. So that's happening right now with restaurants. And of course, they've been under curfews. You got to close at 9 o'clock or whatever it is for quite a long time. So yeah, I think those people in particular, they felt the heat that it's not about political lines anymore. It's about survival. It's about providing for their family. It's about keeping a business open that perhaps they've spent over a decade, but maybe they've inherited from their parents, and they're closing not because of COVID-19, because of how the government is responding.
Right. And you mentioned this earlier, but this really does get to the heart of the left-right divide in terms of the left's approach to expanded government. And what's particularly been confounding for me, and I'm curious as to how you think that this has worked over the course of the pandemic, is that restaurants are a great example of an arena for personal choice to kind of drive the market. So that is, if we're in a pandemic that doesn't really, pose a grave lethal harm to the vast majority of young people without underlying medical conditions that might be complications, then young people would still have the opportunity to patronize these restaurants, and old people can make sort of the personal decision, or people with medical conditions can make the personal decision to stay home. That really hasn't even been part of our conversation about these lockdowns. The sort of role that individual choice plays in both the market and in public safety. And I'm wondering why you think that is. Does it speak to how much we've departed from the kind of framework that the country was founded on?
Oh, well, 100%. Yeah, it's because it's not about leaving things up to personal choice. This is about control. again, not to get into the mask debate, but personally, I feel that mask mandates are simply a way of control. I know in so many places, not all places, but I'm in many, vaccine mandates are coming. They're coming. And I almost feel like, a mask mandate is a training ground. I truly, this is all about control. This has never been about personal choice. And the interesting thing, you bring up restaurants again, and whether or not young people should go or old people should go. I don't know if you saw this. This was national news 5 or 6 weeks ago. There was a local group that did some FOIA requests and got some emails from our local government here in Davidson County in Nashville from Mayor John Cooper. And it was they doing some intense contact tracing here. Well, they had concluded in their contact tracing of these thousands and thousands and thousands of COVID cases, they were able to trace, I believe it was 22 cases to restaurants. 22.
Yeah.
They traced like a few thousand or so to construction work jobs and all these other things, but they traced 22 to restaurants. In some emails back and forth between Mayor Cooper and his administration, they decided to not reveal those numbers to the people and wordsmith the research in such a way that they did not reveal the disparity between the amount of cases that were happening elsewhere in the restaurants, so that they could continue to keep the restaurants limited to 50%. Because even though the data said otherwise, they felt it was the right thing to do. Even though our contact tracing doesn't show that restaurants are causing spread, we just think they need to stay closed anyway. So let's not tell the public that this is what we found.
It's such a strange dynamic, because those are the same people who insist that they are either the party of science or the fastidious followers of science. And so why do you think it is that they will look at that 22 case number, for instance, and then insist on restaurant lockdowns? Like, what explains the disconnect there?
I don't know. I don't know. I mean, I'm not a liberal, so I don't know.